2,963rd death is a 76-year-old male from Kanawha County. The 2,964th death is a 90-year-old female from Putnam County. And the 2,965th death is a 53-year-old male from Morgan County. 2,965 people. It's really, really a shame. We have 429 new positive cases since the last update. Our daily positivity rate is at 5.73, which is very high. Our cumulative number is at 4.94. Now get this number. We now have active cases in West Virginia. We dipped down below 1,000 not long ago, and we were really proud of that. We're at 3,372 active cases. This is the first time we've been over 3,000 since June the 10th. Absolutely, our recovered cases still stay about the same. We now have over 200 people hospitalized in West Virginia, 210 people hospitalized, 68 people in the ICU units. We have 5 red counties in West Virginia right now: Marshall, Wetzel, Upshur, Wyoming, and Cabell counties. We have 12 orange counties, 6 gold counties, and 13 yellow counties. You know, if you add them all up, we got 17, 23, 36 of our 55 counties are out of the green. I remind you again, you'd be very foolish if you were 65 years of age and older. Absolutely, if you get any symptom whatsoever, you've got to go get tested. You have to go get tested. Whether you've been vaccinated or not, go get tested. Absolutely, these antibodies could very well be the very ingredient that saves your life. Today we have 14 outbreaks now. We're up in our long-term care facilities, up 6 from Monday. We have 10 outbreaks in our church communities in 9 counties. That's Cabell, Fayette, Jackson, Jefferson, Marion, McDowell, Nicholas, Putnam, and Raleigh counties. We have 29 inmates. Just the other day we had 1, and 4 staff cases, in our correctional facilities. 20 of these inmate cases are at the Stevens Correctional Center in McDowell County. Can I just tell you very quickly just this? I had the opportunity to speak yesterday in Wheeling at the municipal leagues. And they had a great turnout of people. The building was completely filled with people, and they were excited. Congressman McKinley was there, and I'm sure there was other dignitaries there, lots and lots of mayors. You know, I looked out over that crowd, and really and truly, in speaking, I talked about all the goodness that our cities and our villages and all the different towns all across the state and everything, and all the goodness that they bring to our people. And I said to them that, West Virginia is one of the last safe havens that calls home home. And it means so much to all of us. And these people are the engines that make us drive and make us go forward and everything. And all these communities all across our state are so vital to us in every way. And what they do is terrific stuff. We all know, and I also commented, we all know that the last 15 months or whatever it's been have been really tough on everybody. I said to everybody there that this has touched everybody here in some way or another. There's no question about that. I urged them to get vaccinated if there's anyone there that wouldn't be vaccinated. And they were all sitting in close proximity to one another. And of course, they were eating, so nobody had a mask on or anything. And I said to them just this, and it's true. I said, the likelihood of someone right in this crowd right here, right now, that has the Delta variant is very high. And with that, we all know the infectious rate of that variant is off the chart. We all know from our medical experts and everything that's been proven is if a person has this and they're expelling as they speak or they talk or they sing or whatever it may be, that the particles are 1,000 greater to 1,400 greater than that of a person speaking or whatever that has COVID, the likelihood of infection is off the chart higher. I said, do you realize that those of you that are sitting here right now that are not vaccinated are taking a hell of a risk? That's all there is to it. You may very well not get this, but you are taking a hell of a risk. Sitting here today, as close in proximity as we are, and knowing just how infectious this Delta variant is. I don't see how you do that. And you can eliminate that completely if you're vaccinated. 99.9% effectiveness if you're vaccinated. We all know, right here's the numbers. We all know 14 outbreaks long-term care facilities, 10 outbreaks in our churches, 29 inmates up from 1, 3,372 active cases in West Virginia, up from where we dipped below 1,000. 36 of our counties that are in the red, the gold, the orange, the yellow, not in the green. We all know, 9 more people died. We all know how to stop it. All we got to do is get vaccinated. I'm going to read all this to you because this is terribly important. But yesterday and today, our flags are flying at half-staff. The reason is really, really important. Yesterday, flags were lowered in honor of Navy pattern maker, First Class Stanislaw Darwell of Thomas, West Virginia, a fallen sailor who's been returned home to be laid to rest. On August 5th marked the day of memorial services celebrating Darwell's life. Darwell was on the USS Oklahoma at Pearl Harbor on December 7th, 1941, when the ship was attacked by the Japanese aircraft, sustaining multiple torpedoed hits and quickly capsized, resulting in the deaths of 479 crew members, including Darwell. He was 25 years old. Darwell's remains were laid in a Honolulu cemetery and recovered in 2015 and identified using DNA and other analysis on March the 25th, 2021. Today, flags are lowered in honor of Army Corporal Pete W. Conley of Chapmansville, West Virginia, a fallen soldier who has been returned home and laid to rest. Today is the day of memorial services celebrating Conley's life. Conley was a member of Company K, 3rd Battalion, 31st Infantry Regiment, 7th Infantry Division. He was reported missing in action on December 12, 1950, when his unit was attacked by enemy forces, in North Korea. He was 19 years old. On July 27, 2018, following the summit between President Trump and the Korean Supreme Leader Kim Jong-un that happened in June of 2018, a negotiation to return 55 boxes of remains. And Conley's remains were identified on June 5th, 2020. So today, you see these flags at half-staff. And I ask you to please remember 2 fallen heroes. But not only that, please remember all those that serve to give us everything that we have. In reading through this, I stumble. I stumble because I'm sitting there thinking about my dad and all the people, that just absolutely went in their bravery off the chart. We lost Darwell at age 25, and we lost Conley at age 19. Can you imagine? Can you just imagine? The stories of kids that were, fighting the war so many miles away, that 6 months prior to that, they were at their high school prom. Absolutely, it is unbelievable what these people did to sacrifice to give us what we have just here, right here today. So please, please remember these folks. Remember all those that are still doing it every single day for us. We love them and we thank them. Okay, I've got some other announcements, and this one I'm really proud of. We've filled the PSC position with a great man, a great, great man in Bill Rainey. Bill has served this state beyond belief in every way. He worked hand in hand and led the charge, with the Coal Association for years and years. And Bill, absolutely, he'll be sworn in the coming weeks. And I know Bill will do a tremendous job. He loves our state beyond good sense, just like I do. And I think the world of him. He is so qualified and so versed, it's unbelievable. And Bill, I know you will do one whale of a job. And so it is absolutely with great, great honor that I'm able to announce that appointment. And I'm also, I want to read this to you, that our PSC, now this is prior to Bill being on because he's coming on in the next little while, but the PSC on Wednesday granted Appalachian Power and Wheeling Power approval to make upgrades necessary to comply with the federal environmental regulations at the Amos and Mountaineer and Mitchell coal-fired power plants. This is great news. This is really great news. It extends the life of these plants to 2040. I commend the PSC on this decision. I think it's the right decision. As I've said so many times, we cannot afford to risk our baseload generation, capabilities and capacities, and we must do everything to protect these plants and everything, to protect that baseload capacity, to protect these great jobs all across. Renewables, in my opinion, we want to embrace renewables. We want to embrace the clean energy efforts and all that kind of stuff. But we're not ready. We're not ready. And, and hopefully we'll be ready someday. But right now we're not ready. And anybody that feels like, oh, well, we can immediately move to renewables and we don't need coal, we don't need gas, we don't need oil, we're just going to move right now. That is a frivolous, silly thought. And it is absolutely wrong. And not only is it wrong, in the meantime, we're going to lose a lot of great jobs on an experiment that is going to absolutely turn around and bite every last one of us right in the butt. And then if that experiment fails, which I know it would fail, on the renewables, everybody's going to be standing on the street corner screaming, "Drill, baby, drill." And so with all of that, I am tickled to death, that we, as we move forward in life, that we will continue to try to embrace the renewables. We need both without any question, but today, I'm really proud that, on Wednesday, our Public Service Commission, made a terrific decision here that's going to prolong those power plants and everything, till 2040, and that's really good stuff. I told you about, my visit to Wheeling and everything with the municipal leagues. Also at Wheeling, we did something that was really neat. There was a playground that was being dedicated, and it was an all-inclusive playground. Now, what do I really mean by that? It has all kinds of wheelchair and handicap accessibility and autism accessibilities and everything for kids that are suffering in a lot of different ways. Now, with that, all this was put together, pretty good ways back. I didn't expect this, but I guess it was on Wednesday evening. My sister came in from, really, they live in Colorado now, and they had lived in Houston for a good while. But they came in, and I hadn't seen my sister in a little over a year, and of all things, tough things happen to everybody in life and everything. But my sister was pregnant with twins a long time ago. She lost one of the twins, and the other was born a boy, beautiful young boy and everything, just beautiful as he could be, blonde-headed and just as pretty as he could possibly be in every way. And lo and behold, by whatever reason, it was, he's autistic. And she was never able to have any other children, but this young man now is my size, and he's in his early 20s, and he's just a beautiful, wonderful, wonderful young man. That's all there is to it. He surely had issues and problems and everything, but really what a beautiful, beautiful life and a wonderful, wonderful young man. But it just worked out that, through the schedule that I ended up yesterday at the dedication of this playground. A playground that really and truly has three components to the playground that are the first not only in the state or the first in the nation, but these three components that help kids that are having some form of problems, no matter what it may be, to feel all-inclusive. And that's what we should be all the time. That's where exactly we should be. But of all things, my sister called and said that she wanted to come in and see everybody. And in addition to all that, I end up in Wheeling. And what a wonderful day. What absolutely it couldn't have been better. Once I found out that I was going to where there's a bunch of kids, I took baby dog with me, and she had fun, the kids had fun, and I was tickled to death. I mean, that's just all there is to it. We cut a ribbon, that's the park behind us, and Delegate Erica Storch was right there with us, and she was helping me try to cut the ribbon and hold baby dog all at the same time. I had baby dog under my arm, but Erica, I thank you a bunch because baby dog was a load right there. But nevertheless, what a wonderful day. I congratulate all those with the YMCA, that absolutely put this all together and built the park, and what an unbelievable job those folks are doing there. They have a daycare, a function there. They can take 100 kids, and imagine this, they have got a 6-page waiting list, for people, that are wanting, in that daycare facility. And the fellow that's running that, unbelievable the work that they do. And so all those that were there, whether it was, I think it's Jamie and Lorraine and Tim and all those that were there. I know Brian runs the daycare, and thank you so much. You do incredible work. Thank you again. Other things from the booster battlefield assessments, we're off and running on that. We're working it in every way we possibly can, and we're going to get more and more information. If you're 60 and older and you are 6 months out from when you were vaccinated, we'd appreciate you calling in, and we're going to continue to move to get antibodies checked and everything at our nursing homes first, and then we're going to move to others, and we're going to get a lot of great, valuable information. And I think where it'll lead us to booster shots for those 65 and older that are 6 months out, and it'll lead us to great information. The Delta variant, we're up to 129 cases now. It is in 32 counties. Berkeley County still leads the way, as we're having the most cases with 24. It is something that we should not panic about. I don't want to sit here and be crying wolf, but absolutely it is something that we should act on right now. Now, I go back to just this. We're going to be at the state fair. We're going to be at football games. We're going to be all over the place where there's people. We know as simple as mud that absolutely if you get vaccinated, you are protected against this variant. And we know without any question that it is more infectious and more deadly. You cannot possibly ignore what I'm saying, no matter what the reason, whether it be just simple stubbornness or whatever the reason. You cannot absolutely let your family down, your loved ones down, the ability to spread this to other people around you, your neighbors. You cannot let everybody down and not get vaccinated. More than anything, yourself. You cannot possibly take a logical, reasonable risk with absolutely not getting yourself vaccinated. You know, please consider to do so. Please consider to do so. Vaccination rates are way up. We have given out 3,000 of these doses since last Wednesday. That's really good. We're at a total in the state of 1,069,935, total West Virginians that have received at least one dose. It's well over 1 million folks. The effectiveness of our Do It for Baby Dog campaign or whatever the campaigns may be, it's hard to argue. I mean, how in the world could you argue us being at 89.6% of the 65 and older people that have had one dose, 82.7% of the 50 and older with at least one dose, 68.7% of our population 12 and older, and we all know in West Virginia, we knew it all along, that West Virginians are a little on the stubborn side from time to time, and it may be harder to get us all across the finish line, but we're getting there. And we're getting there through all kinds of methodologies. Even right now, we have another campaign that we're starting where there's going to be, I think, 12 schools that are going to be awarded $50,000 to do with what they choose, with the schools with the highest vaccination rates in public and private, single A, double A, triple A, I guess 4A, so nevertheless, we've got all that going on, and Superintendent Birch, jumped right in and brought that to my attention on what we could do there, and that's great stuff. So with all this being said, we're just going to keep trying and keep clawing and trying every way to get every person we can get vaccinated, because we know, and I don't want to be beating a dead horse here, but absolutely, we know that the more vaccinated, the less will die. Vaccine eligibility, 12 and older, get your second shots. Vaccine effectiveness is off the chart good. We need our young people. I mean, think about going to school. Just think about it. And I know too, that if you go into a school setting and you're in there, especially without a mask, and you're going to school every day, and we hope and pray we don't have a disruption in the school schedules and everything, there's got to be some people there that have the Delta variant. And it is so contagious. Well, how in the world can you take the chance? How in the world can you take the chance with your kids for them not to be vaccinated? Help me. Get tested. Take advantage of the free testing. Thanks, Walgreens. Thanks, Fruth. From the standpoint of your face coverings, there's no mandate whatsoever at this point in time. We will stay open-minded about what we have to do in regard to that. I absolutely hope and pray I don't want any part of doing that right now. There is nothing on the schedule to absolutely do a mandate on masks at all. I want everybody to understand and be perfectly clear on that. However, if you have problems medically and you're 65 and older and you're in a crowd of people and everything, you may want to think about it. It may help at least some. From the standpoint of our sweepstakes on Baby Dog, we've extended our Do It for Baby Dog sweepstakes until Sunday night at 11:59 is the cutoff on registration. If you need to get vaccinated prior to that time. If you're not vaccinated, if you are vaccinated, you need to register. It takes about a minute to do so. You know, the final crop of all of our prizes and everything will be given out on Tuesday. You know, we have two big cash prizes, one $1,588,000 and another one $588,000. We've got trucks and scholarships and everything else that goes with it. It'll be our last ones we do. I encourage you absolutely to register, and I encourage you to make it to before the deadline and get vaccinated. There's all kinds of places where you can get that done today or over the weekend. You should absolutely do that. I do not know how in the world you can be staring this risk right in the eyes and not move to get vaccinated. Now listen, I know as well as I'm sitting here that the sun's shining, and I know that the lakes are out there and all the wonderful places that you can go and fish or ski or whatever it may be. I know that how much fun is going on right now before the days are getting shorter and shorter, you know, to where we'll be back at school. I know all this is going on, but let me tell you this. The number one thing that you should be thinking of right now, if you're not vaccinated, is taking enough time of your day, some way, somehow, and get yourself vaccinated. I know how much fun everybody, and I know how that we're going back to school, and I know all that. But today, with the risk that's out there, you need to move today. That's all I've got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. As the governor has said, we are seeing a more rapid rise in the impact of the Delta variant in West Virginia, and some absolutely fast-breaking news. We, in our last sequencing run, have now seen that the Delta variant accounted for 91% of the new viruses that we were able to sequence. So it is continuing to grow. As we've talked about before, this variant is very much more infectious. Infects like the chickenpox can infect from contaminated air. So just like the governor said, anybody who's not vaccinated right now is really a very high risk of having a potential severe outcome from becoming infected. And we know that this variant is not only having an impact on the number of new cases that we're seeing test positive and be identified as the Delta variant, but also, as the governor said, in the last month, we've seen a fourfold increase in hospitalizations, ICU admissions, people on ventilators. We have seen over 2,000 new cases in the last week, both suspected and confirmed. And we know that our percent positivity has gone up over the last week to 10 days. And so as we are looking at the future, we are right now starting to see a much steeper inflection of the Delta variant as it's been spreading. And now it is starting to spread more in the open. And therefore, we know that the really best protection and ultimately the only reliable protection for this variant is to be fully vaccinated. We know in the hospitals in the United States today, we are over 50,000, which is more than we've seen since February. In the state of Florida, they have hospitalized 143 children, and in the state of Texas, 140 children, more than ever before. And we know that children are not immune to this variant, and this variant can certainly make children who are unvaccinated sick as well. So we know that we've said this many times, and sometimes it can probably seem like we're just talking to ourselves, but the governor has asked us to do two things in this pandemic. Number one is to save lives and improve the well-being of our state, which we embrace wholeheartedly, and we want nothing but goodness like he does for each person in our state. And number two is to maintain the capacity of our hospitals and the function of our hospitals. We just had a call with the Hospital Association and its leadership this morning, and I would just tell you that everybody is very concerned about what is coming. We are making provisions and plans to try to make sure that we have a sufficient ability for our hospitals to function, as we believe that this variant is going to make more and more people sick in the upcoming several weeks. But we also know that with our unvaccinated population and our chronically medically ill population and older population in West Virginia, we are at very, very high risk to see a set of problems that we really haven't seen yet in the pandemic. And certainly vaccines make a huge difference, and the people that have been vaccinated will help us here, but not enough people are vaccinated, not enough of our children, not enough of our citizens. And although right now may be too late to keep the problems from impacting and affecting West Virginia from the Delta variant, it is not too late to make that investment in your own health, your family's health, your community's health. And we really, really urgently urge each West Virginian who has not been fully vaccinated to please choose to get vaccinated with an mRNA vaccine, Pfizer or Moderna, and get it today. No time to wait. And as we go forward in the next several days, what we are very aware of as we look at the slope of the increase that we've seen from India and that we're seeing in the United States, and we are starting to see in West Virginia, that this variant is going to cause more explosive spread and more explosive illness than we have seen before. And the way to avoid the absolute maximum impact of that is only to get vaccinated and to make sure when you are out around other people that you don't know, crowds indoors, please consider wearing a mask and consider all the other mitigation measures that can protect you, including distancing, hand washing, covering your coughs and sneezes, but also not going out if you're sick, and making sure that you, as the governor has asked, please get tested if you do have any symptoms of a cold or infection, because at this point, anything we can do to reduce that spread, reduce interaction in people who might be infected is really protecting not only you and them, but our entire state. Thank you.
Thank you, Dr. Marsh. Next is Secretary Bill Crouch with the DHHR.
Good morning, everyone. We've had several questions regarding vaccine replacement cards. The primary function of the vaccination card is to serve as a personal immunization record. You should have been given a card at your first vaccination appointment that includes the vaccinations you received and other details. If you lose your card, contact the location of your first shot and ask that they'll give you a replacement. Take an ID and try to recall the date you were vaccinated. If you received 2 shots at different locations, contact the site where you received your second dose, which may be able to provide you information needed for a completed card. If you're unable to retrieve vaccine information from a location, you may complete the COVID replacement card form linked on the website coronavirus.wv.gov. That's coronavirus.wv.gov. Thank you.
Thank you, Secretary. Retired Major General Jim Hoyer is also joining us today and is available for questions. Dr. Anamjad had a prior engagement today, and she will rejoin us next week. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
Good morning, Governor. Good morning, cabinet members and staff and fellow reporters. My question is this. I was crunching the numbers here, and I see that there are 31% of people aged 12 plus still haven't gotten vaccines, even the first shot. With that in mind, what is the game plan? And I wish Superintendent Birch was here to talk about it, but what is the game plan for our school systems? It seems like there's an opportunity next week when all middle and high schools in the state will be opening in the next couple of weeks to have in-person clinics at those middle and high schools run by the county health departments of jurisdiction. Is there any game plan like that being put into the works? Because it seems like if you took the shots to the people that really need them most, you might have a very effective return on your investment.
I think General Hoyer can answer this better than anybody. I think you'll find we're on top of that, but General Hoyer, please answer.
Yes, sir, Governor. So, Mark, there are in a number of our schools across the state, there are health clinics embedded in those schools, and we are coordinating with Superintendent Birch, Deputy Superintendent Blatt on making available to locations and schools that have those clinics, as well as others that need those. Those are coordinated with the local county health departments. You make a good point that going to the point of source is important, but also understand that in that age group, we also have to have parental consent. So there's a lot of work that's got to be done behind the scenes with the schools to work through that. But there is an active effort going on to ensure at that level and in other places across the state, we get vaccines to the point of source and to include primary care clinics and pediatricians' offices. Thank you.
All right, thank you, Mark. Next to John Mark Shaver with WV News.
Good morning, everybody. I have a question for Dr. Marsh as well. We're in the middle of vacation season. I know a lot of people have already made plans to go to Myrtle Beach or other places, but do you have any recommendations or suggestions for those people planning to take out-of-state vacations in the coming weeks?
Dr. Marsh, please.
What I would say is I think that this is a particularly important issue because as we go out and around going to other states which may have more local prevalence of the Delta variant of COVID-19, or even going around places close to your home here in West Virginia, it is so important that we consider a person's vaccination status. If people are fully vaccinated and 2 weeks out from their final vaccine, they should feel very comfortable that they are very unlikely to have severe consequences of getting reinfected, even if that would be the case with the Delta variant, as far as hospitalization, ICU admission, or death. But people that have not been vaccinated should be very, very careful. And we would encourage everybody, as the CDC has pointed out, who is out around other people you don't know, indoor crowds, indoor shopping, to consider wearing a mask whether you're vaccinated fully or not. But this is a particularly dangerous moment for anybody in our state or in our country who is not fully vaccinated, as this Delta variant is extremely, extremely infectious, on the order of chickenpox. And as the governor said, we know from studies that have been published that there is over 1,000 times more virus in the airways of people infected with the Delta variant than we saw with the initial COVID-19 virus that came from Wuhan, China to Washington State here in the United States.
All right, thank you, John. Next to Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking my question. I have two for the governor. Governor, if you could address both of these things, I'd appreciate it. One, you mentioned Bill Rainey, who I've worked with for many years in his position as the Coal Association. And while you had glowing words for Mr. Rainey, and most people agree with you, some concern has been raised already that the PSC might be tilting a bit toward the coal industry now, with two appointees on the board, including Commissioner Lane, who have very deep ties to the coal industry. And those concerns have been voiced about making sure that the PSC, the commissioners, remain fair to consumers and not tilt in the direction of the industry. Can you address that? That's the first question. And secondly, you very kindly and gently said that West Virginians can be a little bit stubborn. And you are correct. And Mark Curtis asked about vaccinations for those who are eligible, 12 and over, and he mentioned that 31% don't have at least one dose. What's more troubling is that, by my math, about 43% aren't fully vaccinated. So, 31% have at least no dose, and 12%, 34% are not vaccinated fully. So can you attribute that to just stubbornness, or is it politics, or is it religious beliefs, or is it the mixed messages from the CDC, or is it a perfect storm of all those things rolling together, keeping people from getting shot? Thank you.
Well, Kenny, let me address your second question first. We are stubborn in West Virginia. That's just all there is to it. And I'm probably that also. And we got that from our ancestors. But our stubbornness, has led us to be wise in many, many ways. And our commitment and conviction, has led us to be wise and has made us who we are in this state. And absolutely the loving, appreciative, great neighbors, people that absolutely will give you, the shirt off their back. That's who we are. Now, in that, our characteristics can get in our way from time to time too. We do have, whether it be 31 or 43 or whatever the percent, but it's low. It's low from the standpoint of our kids, that have been vaccinated. We have knocked it out of the chart with our wisdom, and our kids need to listen to our wisdom. Our kids don't need to be just continuously thinking that they're invincible, but our parents believe our kids are invincible. And some of our parents believe some things that are just not possible at all, in my opinion. And that is, that there's some tracer in the vaccine and the federal government's going to know where you are and all that kind of stuff. Well, for crying out loud, that's as silly could possibly be. And the reason it's silly is because if you've got a cell phone, they know where you are at all times. If you've got a driver's license, the same kind of things. That is silliness, in my opinion. We need absolutely. There are so many contributing factors that, Kenny, if you say, well, sir, do you like your eggs scrambled or fried? And the answer is yes. Are there things like the inconsistencies with the CDC and information, the Johnson & Johnson scare that came out? Are there other contributing factors to why people are not getting vaccinated? Well, absolutely. What's the choices that we have? Somebody, pray tell me, what are the choices we have? To lay down our pen and say, let die whoever's not going to take this, or try. And I choose to try. And that's what it's all about to me. And as far as Bill Rainey and the PSC, I would say just this. I don't think that there's any way that whether it be, Charlotte or Renee or Bill, and all those are our three, I don't know how you could pick three people that will be more absolutely fair to everybody, to anybody and everybody, because they are just that. However, I don't want us ever to walk away from our coal producers. I don't want us ever to walk away from the fact that we are a natural resource state, and we should be dadgum proud of it in every way. I think that Bill Rainey will do a fabulous job, and in every way that I could imagine. So as to the other commissioners, and I think they do great work. They've protected us in every way. We have absolute great energy costs in this state and an abundance of energy beyond belief. And I think as we go forward, we do We do everything to embrace all sources, all the renewables, all the gas, all the coal, everything. We embrace it all and move forward. So, I think Bill Rainey will join the ranks of two other individuals that are doing great work, and it'll be just an absolute great threesome that'll do fabulous stuff for West Virginia.
All right, thank you, Kenny. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. First, a cautionary tale. I had a high school classmate living in Florida come down with COVID-19 2 weeks ago, and his elderly mother was living with him. She has since passed away. They both said just a couple days ago that they wish they had gotten the vaccine. And I know there are a lot of families in West Virginia that are in that same boat. The question is, and I think this goes to a number of people out there that may not be as informed, and that goes to getting the vaccine and COVID-19. COVID-19 is not going to go away. It's not going to burn itself out. I'd like to hear those words or something like it, or even a correction from Dr. Marsh, the people out there that believe that, well, look, the state almost went all green just a couple of weeks ago, and look, I was just about right. Dr. Marsh, could you address that we're going to be dealing with COVID-19 for years to come? Thank you.
Well, before Dr. Marsh goes, let me just say this. And I, of all people, I'm your governor. How many of these horror stories you think I've heard? How many of them have I heard? And they weigh on you. They absolutely weigh on you. How many horror stories do you have to hear, I can't tell you the number of people that are either their loved ones are taking their last breaths or they've lost them. And they say, I can't believe we didn't get vaccinated. I mean, I wish like crazy we'd been vaccinated. Exactly what Paul just said. Or their loved ones are gasping for air and they're absolutely saying, is it too late? Can we get vaccinated now? And the doctors are looking at them and saying it's too late. The horror stories are unbelievable. And if you're the governor, you've heard way too many, way too many. Dr. Marsh, take over and answer the rest of that, please.
Thank you, Governor, and thank you, Paul. Paul, as you very correctly point out, that the virus will likely continue to get more fit and more able to infect us, because that's what the virus is made to do. And it is really up to us to get even more fit than the virus. And the way we get more fit than the virus best is to become fully vaccinated. And with this particular virus, it now would take about 80 to 85% of the world or of the state or of the country to get the kind of immunity that would be enough firewalls to stop the virus. But we also know that people that get sick from this virus and recover will also add to that firewall. The problem is, though, people that aren't vaccinated who get sick from this virus are likely to get real sick. And that's not everybody, but that's enough people that we know today in our hospitals in the country, of which we have now more hospitalizations, more than 50,000 hospitalizations we've had since February, that not over 95% of people in America's hospitals are unvaccinated, and over 98% of people that are dying today in our hospitals in America are unvaccinated. So we don't want to get to that fitness by having so many people have to die when we have vaccines that are so effective. And that's the reason why we're really urging, to the level of almost pleading with people, to really consider vaccinations, because they will likely either save your life or save somebody's life that you know. And by us choosing that, we not only help each other, but we help our state and help our country.
All right, thank you, Paul. Next to Veronica Obey with WDTV.
Good morning, everyone. Governor, you mentioned that the vaccine rates have increased. So I was wondering from you and Dr. Clay Marsh and maybe even General Hoyer, in regards to this, do you think this increase is coming from the sweepstakes, or is it happening because of the variant and what we're seeing happen across the country, and also more specifically to Dr. Clay Marsh and potentially General Hoyer, with you both being in the communities within the healthcare field and being at these vaccination clinics, what are the results that you all are kind of hearing or seeing, and what are you also hoping for in the future? Thank you.
Veronica, I think I can answer it, and we'll have you some more detail, in the days ahead after we wrap up the Do It for Baby Dog sweepstakes. But I think our efforts all in, have really made a difference. And evaluating what the difference is, there are naysayers out there that, would look at you and say, well, you spent a bunch of money here and everything, and you got these number of people and everything that crossed the finish line and got vaccinated. But at the end of the day, we all know that we raced way ahead in West Virginia. Man, we all know that West Virginians are kind of a stubborn folk, me included. And absolutely we knew we were going to hit where it was going to be really tough. And so we've moved forward, have we not? We've continued to get more and more and more. And even though it was really tough, we've gotten more, haven't we? And with that more, we've saved lives. Lots of lives. Tens and tens of lives, if not thousands of lives. We have saved lives. What are they worth? The federal government gave us the money to encourage us to do exactly what we've done. We had the money. We surely weren't taking money out of somebody's pot that really needed it. We had the money and everything to be able to move forward, and we did, and we saved lives. And so I'm tickled to death with what we've done, and I'm really proud of all the people that have put everything together, not just with the Do It for Baby Dog stuff. But Veronica, to answer your question even more right to the point, we're still doing the Do It for Baby Dog stuff with the Delta variant right here with us and everything. There's no question whatsoever that now we've got a twofold process going at the same time. We got people that are perking up and listening, as I've said before, all of a sudden you've got another threat, this Delta variant, and people are saying, whoa, that's really something I need to deal with, and maybe I need to consider this vaccination on that thought. And they've got also the combination of the Do It for Baby Dog stuff that's going on. And so all of a sudden they move forward and they get vaccinated. That's great stuff. So I think, again, it's a combination of everything. I congratulate those that have gotten more and more and more people across the finish line. And it makes it easier, naturally, for someone to say yes when you've got the Do It for Baby Dog stuff going on. But bottom line is, the choices are just like I said a minute ago. Either lay your pen down and say, well, I've done all I'm going to do. I've done all we can do. If those that, even like General Hoyer said to me the other day, over at the mansion, and he said it with some choice words, but he said, let blah, 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 just go ahead and die. If we haven't done enough to inform people, then we can't do anymore. That's all there is to it. There's just so much you can do. And then I said, no, General, and he felt the same. Really and truly, we got to continue to try. And so that's what we do. We just keep giving it another pound of effort. And so, Veronica, it's a combination of all.
All right, thank you, Veronica. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everybody. Governor, as you've said loud and clear, West Virginia's numbers are getting worse. 5 counties now red on the map, more than 3,000 confirmed cases of COVID-19. Meanwhile, something else is going on, the approach of the school year, and nobody wants any disruption this year. So those two big things are converging with time running short. If these COVID trends continue, are there contingency plans for the opening of schools, or would adjustments be announced if the situation calls for it? Thank you.
Brad, I think it's just as obvious can be. There's absolutely contingency plans. No one wants to look at the alternative of our kids and face the fact that our kids not going back to school. Our kids desperately need to go back to school. And right at this point in time in life, we do not see a need to address the possibility of our kids not going back to school. But Brad, you ask a very open-ended question, and that is, if this thing continues to get worse and worse and worse, is there a possibility? Well, of course there is. Of course there is. There's a possibility of having to pivot and do a lot of different things. If this thing absolutely gets so bad, are we going to have to wear masks for our kids that are not vaccinated in I guess our elementary schools or middle schools and below? Will that help? And is that something that we may absolutely consider? Well, absolutely. Right now, there's no need to panic. There is a real need to get vaccinated, but and a real need to get our kids vaccinated. But there's no reason to believe right now we're not going back to school. There's no reason to believe we're going to have to wear masks for our little kids. There's no reason to believe that the wheels could completely fly off. But if they do, we'll have to pivot. We'll have to move.
All right, thanks, Brad. Governor, I'll turn it back to you to close out.
Well, I just like to add one other thought. The bottom line that we all have to do. We have to do this. We have to protect the well-being of our citizens in every way. Every way. Whether it be our kids, if we have a total meltdown that maybe Brad's talking about, we have got to be able to protect our kids, but at the same time, our kids have suffered unbelievably by not being able to go to school. And we got to go to school. We got to be able to go to school. But we'll do whatever we have to do at the end of the day. We've got also our elderly to take care of and look after in every way. Absolutely, I keep going almost in a circle all the time, do I not? And the circle is just this. Whether it be our elderly, as far as them helping and them stepping forward, if you're fully vaccinated, step forward and help us get our kids vaccinated. And if it be our kids and your grandma or your mom and dad aren't vaccinated, our kids need to be encouraging them in every way to be vaccinated, because we don't want them really sick, do we? This is a circle. It absolutely is a circle. And the way the circle functions and the way the circle works is we all stay together. Now, I've got a couple other things. I want you to really, really, really dial into what I'm getting ready to tell you. But for West Virginia in general, if you think about just West Virginia, it's too late. It's too late to stop this Delta variant invading West Virginia. It's too late. But it is not too late for you. It's not too late for you as an individual to get vaccinated. Your kids get vaccinated and be protected. But we can't stop the Delta variant from coming to West Virginia now. We maybe could have if we would have been more vaccinated than we are, but we can't stop it now. From a standpoint of Dr. Marsh just got through saying things and making recommendations, that said, when you're out, you should watch your distancing, you should, cover your mouth if you're coughing, you should wear a mask if you have some health issues, you should wash your hands, you should still take advantage of getting tested. Is that an echo? Is it just that? Have we not heard that over and over and over, and it finally, thank God, went away, and now here it is back? And the reason that it may be back is we just don't have enough of us, that are vaccinated. It's an echo I don't want to hear. It's an echo that I don't think any of y'all want to hear. But absolutely, he just got through saying it. Just got through saying, if you're out and you cough or whatever, cover your mouth. Utilize the distancing if you're out in a bigger crowd. Wear a mask if you've got some kind of health issues. Wash your hands. Take advantage of getting tested. Be cautious, and all that kind of stuff. It's voices speaking that we really, really don't want to hear those words again, and we will continue to hear them, and it will only get worse if we don't really aggressively run and get vaccinated today. There is nothing any more important today with the sun shining than getting vaccinated. Got to do it. I love you with all my soul, and I just want absolute goodness for all of us. I know how we can get there. You got to help me, everybody. This circle is a circle of love and a circle of togetherness, and absolutely, you have got to help me. If you're one of the young children and your mom and dads or grandmas or whatever are not vaccinated, really push them with all in you to get vaccinated. You don't want them sick. And if you're absolutely an adult or the elderly and the kids aren't vaccinated, push to try to help us get those kids vaccinated. They're getting ready to go to school, and we want to have a wonderful school year, and we need them vaccinated. That's all I got. Thank you so much.